Hi everybody, Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today is just a really short video to talk about some different insurance type plans that are out there, with the two most common being PPO versus HMO plans. There's also EPO plans and POS plans, and that doesn't stand for what you think it is. It stands for point of service. But we're not going to talk about those because they're not as common in most parts of the country. The most common plans that people are most likely going to experience with patients coming into their office are going to be the PPO plans and the HMO plans. Usually, as people get closer to their open enrollment periods for new insurance at their place of employment, they're going to start asking you and your staff if you take certain insurance plans, if you know the difference between this and that. And it's a good knowledge base to have and pass on to your staff if you don't know already the differences between a PPO and an HMO. A PPO plan is a preferred provider organization. That means that patients who have a PPO plan or policy under whatever payer they have is going to have a lot of flexibility in what providers they get to see when they need to be seen for certain things. That means if they want to see one doctor somewhere for their family practice and a different doctor for maybe their OBGYN needs, and then go somewhere else for an orthopedic or other specialty need, then they can do that. Usually they don't require a referral or a prior authorization, and it's very flexible. Now, with the flexibility comes increased costs. Increased costs is reflected in the premiums they'll be paying monthly, in the co-pays. Sometimes the out-of-network amounts are going to be higher, or deductibles are going to be higher, but some people are willing to pay that extra money for the flexibility of seeing the providers they want to see, especially if they have been seeing a certain provider for a certain health condition for a while and they feel comfortable with them, they trust them, they know their medical background well, and they don't want to change, then they will pay that extra money. HMO, or Health Maintenance Organization, on the other hand, is usually a little bit lower premiums, lower co-pays, lower out-of-pocket costs when it comes to deductibles and co-insurance. But with that comes more rigidity and more restrictions. They are only able to see providers who are actually in a specific network, and they can't go outside that network unless it's an emergency. Their best bang for their buck is going to be for seeing the patients who are in this specific network, and it's going sometimes to be, to a certain degree, a lack of flexibility on who you see for certain conditions or issues, and sometimes waiting times in order to see someone in a specialty can be longer because of this network and all these people needing to see specialties in this specific network and these providers. And so there's definitely give and take. And sometimes there are HMOs that will allow people to go outside of the organization with a referral authorization or a prior authorization in certain circumstances. So if your patient does happen to have an HMO and it wasn't caught ahead of time, and maybe you're out of network, or it did get approved for a certain situation for them to see you, you need to make sure that you're staying in the scope in which it was approved, or you actually educate that patient and let them know that they might be having to pay for their services from you out of pocket entirely if it wasn't approved, because you're not an HMO provider in that network. Now, in Oregon, Washington, California, and other states, we have a big HMO system called Kaiser, or Kaiser Permanente. And this is very exclusive. So unless you have a Kaiser insurance, you cannot see a Kaiser doctor unless you're willing to pay out of pocket. And the reverse is true as well. They do have one sub plan in it that's called open option or open card, where these people do pay a little bit more, and so they have the flexibility to go out of the Kaiser network and see providers outside of that network, and then it's billed through First Choice Health. But for the most part, people who have Kaiser will always have Kaiser. And people who have had Kaiser for a long time and don't know anything else, and then maybe their employer no longer offers Kaiser insurance to their employees, or they switch jobs, or whatever the fact might be, and they go into a PPO type situation, they are completely lost, because navigating an HMO seems to be a lot easier, because you're told these are the doctors in this specialty you're being referred that you can see. Just call and make an appointment with the earliest doctor available. So they come out and they're like, I don't know how to navigate this. I don't know how this works. Like, you draw my blood and send it to a lab. I'm used to my doctor telling me to go to the lab at Kaiser and they will have my orders to draw my blood, or to go to diagnostic imaging and they know what to do. Where the patients have to be a little bit more proactive and involved in their health care in that regard. So if you have people that are switching from an HMO to a PPO and they're new to you in this whole realm, be very sympathetic to them and help them as much as possible, because usually they're like a fish out of water for a little while until the new process gets explained to them. Make sure your staff understands what the difference between a PPO and an HMO is, and that they're looking for that on patient cards and asking the right questions to patients if they're new to your practice, to make sure that you're not seeing anybody you shouldn't and going to be losing out on any money, or the patient being responsible for a huge bill because they were not aware of the certain restrictions. A lot of times it will say PPO, HMO, EPO, POS on the cards itself, but if it doesn't, when you check eligibility and benefits, it should say what kind of plan it is, and you can usually tell by the things that are covered and the requirements and the out-of-pocket requirement expenses for patients that way too. So there's different ways to be able to identify it. You just have to know about it and be looking for it. So make sure that you are educating everybody, you're aware of it. You don't want to get yourself in a situation where you're seeing a bunch of HMO patients without referrals or prior auths and losing out on that money, because a lot of times they will tell you, if you didn't let the patient know upfront before services were rendered that you were out of network or that their services were not going to be covered by their insurance, that you cannot bill the patient, and you don't want to get in that situation either. So definitely be diligent about this, understand the difference, and then you'll be able to educate patients as well when they're calling and asking questions if they need to change insurances down the road. Smash that thumbs up button if today's visit was helpful. Subscribe to my channel if you haven't already, and take care of yourself. Spring is in full swing now, so hopefully you're being able to get outside and be active a little bit more than we were in the dark winter. Take care of yourself. Bye-bye.